What did your mom do that became legendary? My mom, Linda, was a night shift ER nurse at a small hospital in rural Ohio for 15 years, known for her uncanny ability to calm panicked patients and comfort grieving families. She'd sing softly to scared kids getting stitches, hold hands with elderly patients who'd lost hope, and always found the right words when death loomed. At 16, I saw her become a legend one chaotic Saturday night when a charter bus carrying the local high school debate team and choir, 19 kids, ages 14 to 17, crashed on Route 71 after a tire blowout. The ER was slammed with critical cases, fractured skulls, punctured lungs, severe burns, and kids screaming in pain, their parents hours away due to a regional competition. The hospital was unprepared for the scale. The head trauma surgeon was on vacation in Florida. The backup was mid-surgery on a stroke patient, and the on-call surgeon was unreachable, stuck in a snowstorm 90 miles away. No one would arrive for at least 3 hours. The hospital's chief administrator, a cost-obsessed bureaucrat named Dr. Kessler, made a callous decision: triage the kids and transfer viable ones to a hospital 50 miles away, rather than pay for emergency airlifts or call in surgeons from nearby counties. He figured some losses were acceptable to avoid budget overruns. Mom overheard him in the break room, discussing it with the finance director like they were balancing a spreadsheet, not lives. She stormed into his office, her scrubs still stained from triage, and laid into him. "These are kids, not numbers. Call every surgeon within 300 miles or I'll tell every news outlet you're letting teenagers die to save a buck." Kessler smirked, leaning back in his chair. "You're just a nurse, Linda. Stick to bandages. This is above your pay grade. Make trouble and you're out of a job." Mom didn't flinch. Before nursing, she'd been a combat medic in the Gulf War, trained to handle battlefield carnage, skills most ER doctors never touched. She marched back to the trauma bay, where kids lay on gurneys, some barely breathing. Defying protocol, she took charge. For a girl with a punctured abdomen, Mom performed an emergency laparotomy to stop internal bleeding, using techniques she hadn't practiced since the military. A boy with a crushed chest got a needle decompression to restore his breathing, done in a hallway with a nurse holding a flashlight. Another teen with a fractured femur had arterial bleeding. Mom clamped it with improvised tools. For 3 hours, she worked like a war zone surgeon, stabilizing 19 kids with procedures way outside her legal scope, barking orders at stunned nurses to fetch supplies. Her hands moved with precision, her voice steady despite the chaos. Kids moaning, monitors beeping, blood on the floor. When surgeons from a neighboring hospital finally arrived, they found 19 stable patients, not the expected body count. The lead surgeon, Dr. Patel, examined Mom's work and muttered, "This is battlefield medicine. Whoever did this saved every single one of these kids." Kessler, livid that Mom had defied him, fired her on the spot, ordering security to escort her out as ambulances still lined the lot. What he didn't know was that one of the kids, a 16-year-old choir member, was the daughter of a prominent Cleveland news anchor. When parents arrived and learned Mom was sacked for saving their children, the anchor went live at 1 a.m., airing a segment titled "Hospital Fires Hero Nurse for Saving Teens." Clips of Mom being marched out, still in bloody scrubs, went viral. The public outcry was ferocious: petitions, protests outside the hospital, and calls flooding the board. Within 48 hours, Kessler was fired. The board issued a groveling apology, and Mom was reinstated as head of trauma training with a $50,000 raise. All 19 kids survived, 3 directly because of Mom's rogue interventions. Her story's still told in town, how a nurse turned warrior saved a generation in one night.